Welcome back to our Parent Caregiver webinar series, Before It Becomes More. I'm Corey Hammond from Partnership to End Addiction. In this video, we will be discussing prescription drug misuse and fentanyl, what adults are missing and what they need to know. So first, I'm going to talk about prescription drugs, what prescription drug misuse is, how prevalent prescription drug misuse is among adolescents, what kinds of prescription drugs are commonly misused, and why. Then we will discuss one of the most serious risks of prescription drug misuse, fentanyl. I'll tell you more about what it is and why we're so concerned about it today. And then finally, I'll get into our action steps, what we can do to keep kids safe, both in terms of prevention and harm reduction. So let's get into it. Let's start with prescription drug misuse. So what is prescription drug misuse? It's a term I'll be saying a lot. And this is when someone uses medication in ways that weren't prescribed by that person's own healthcare provider. So that is considered prescription drug misuse. And this can mean using more of a medication than you were told to, using for a longer amount of time, or for a different reason than the doctor told you to. Also using a medication that wasn't given to you by the doctor, so using someone else's medication, for instance. People commonly misuse prescription drugs to self-medicate difficult emotions or mental health issues. People may also do it to enhance or counterbalance the effects of alcohol or other drugs. Prescription drugs most commonly misused are those that alter mood, emotion, or perception. These include things like prescription pain relievers or opioids, so things like Vicodin and Oxycontin, benzodiazepines, tranquilizers or sedatives, so things like Xanax, Valium, or sleeping pills like Ambien, or also stimulants, such as those that are prescribed to treat ADD and ADHD, so things like Adderall, Ritalin, Concerta, and Vyvanse. So this table has a lot in it, and we won't go through the whole thing. You can pause the video if you'd like to take a closer look. But this table illustrates categories of drugs with examples of legal prescriptions and similar illicit drugs, along with the reasons people may misuse certain drugs and the effects that those drugs can have on a person. So as an example, stimulant medication such as Ritalin or Adderall may be prescribed to someone with attention deficit disorder, ADD. But they may be misused by people who want to stay up late to study for a test or to lose weight. These medications, when misused, can lead to insomnia, anxiety, paranoia, and other issues. These stimulants affect the body in similar ways to illegal drugs like cocaine and methamphetamine. So how common is this among youth? You may see this slide in more of these videos, but it's important to level set. Most young people are not using substances. In 2025, almost 3/4 of 8th graders, over 60% of 10th graders, and 41% of 12th graders nationally reported never having used any substance. And so that includes misusing prescriptions. So while this is a serious issue that we want to be aware of, it's important to remember that this is not in any way the norm among teenagers. But in 2025, just over 13% of high school seniors said that they had used any illicit drug other than cannabis in the past year. In this survey, illicit drug use includes misusing prescriptions. If we look at just misuse of prescriptions, 9.5% of seniors said that they had misused a prescription in the past year. So this means that out of all the illicit drug use by high school seniors, almost 3/4 of it was misusing prescription drugs. About 35% of people in the 12 to 25-year-old age group have taken a psychoactive drug in the past year. A psychoactive drug means any drug that changes the function of the nervous system and alters our perception, our mood, cognition, or behavior. So this would include things like ADHD medications, antidepressants, antipsychotic medications, as well as opioids. This doesn't include things like antibiotics. So 35% of young people using medications like this is not inherently a problem. But 31% of the people who were prescribed a psychoactive medication misused it. That's the problem. So about 1 in 5 adolescents aged 12 to 17 used a prescribed opioid in the past year, but 18% of those kids misused that opioid. And so of those who reported misusing a prescription opioid in 2023, about a third of teens and almost 50% of young adults said that they got the pills from a friend or a relative. About 60% of teens and a third of young adults were prescribed it for themselves from a doctor, and a smaller amount, about 10%, bought pills from a stranger. And as much as we're concerned about that last group, most young people are not buying these medications from dealers or strangers. The majority is in our power to really do something about, so receiving pills from a friend or a relative, or getting them prescribed from a doctor. And so this is why young people should understand the importance of taking medications only as they are prescribed, and not taking pills from their friends or relatives, even if they might think it's safe. So why might young people be tempted to misuse prescriptions? There's many reasons, but I'll go through a few. So prescription drugs may seem less dangerous than illegal substances. Because they're legally produced and associated with medical treatment, they often appear less dangerous to kids than illegal substances. And so this perception can spark curiosity and increase the likelihood that a young person might experiment with them, because they're unaware of the serious risks involved. In many social settings, especially among youth, the misuse of prescription drugs can be seen as normal or even socially acceptable. This normalization often stems from peer pressure or a desire to fit in with friends or classmates. Unfortunately, misinformation about the effects and the safety of these drugs is really spread through unreliable sources, like social media or just word of mouth. And so this can lead to a false sense of security. And young people may misuse prescription medications in an effort to sharpen their attention or maintain high levels of energy or alertness. And this behavior is often driven by the belief that stimulant medications like Adderall will enhance academic or athletic performance. And while these drugs might offer short-term benefits, their effectiveness tends to diminish over time. As their tolerance builds, individuals may require higher doses just to function normally. And so this cycle can ultimately lead to a decline in performance, undermining the very goals that motivated the misuse in the first place. We know that more than ever, young people are reporting feelings of anxiety, depression, and stress, which may lead them to self-medicate with prescription drugs. Self-medication is especially common when mental health conditions are not being adequately addressed. They're looking for relief however they can get it. But this can also lead to the development of a co-occurring disorder. So either by triggering an underlying mental health issue or by fostering a dependence on substances that can lead to addiction. And the combination of both, the mental health issue and the substance use issue, is the co-occurring disorder. We also know that caregiver attitudes play a part. Young people are more likely to misuse prescription drugs when certain parental behaviors are present. If parents are lenient about substance use or casually take medication without medical necessity, it can send a message that such behavior is really acceptable. So modeling unhealthy prescription drug use, such as taking pills to relax, reduce stress, or get high, can strongly influence a child's perception of risk. Easy access to prescription medications in the home further increases the likelihood of misuse. Additionally, if parents fail to communicate openly and honestly about the dangers of drug misuse and don't clearly express their expectation, children may be more inclined to experiment with these types of substances. But there's also a lot of other risk factors for prescription drug misuse. So things like a family history of substance use or addiction, early age of first use of addictive substances, trauma, behavioral or impulse control problems, and a lot of these risk factors look similar if you've joined us for any of the other presentations on substances. The one that stands out here is the last one. So being prescribed pain medication to treat an injury or after dental procedures like getting your wisdom teeth removed. Oftentimes, people will be prescribed more of these painkillers than they would realistically need for their recovery. And so then it can become very easy to take more than you need or keep taking them after the pain is gone, and that can turn into dependence for some people. So what are the potential risks and consequences of misusing prescriptions? So misusing prescription drugs during adolescence can cause serious and lasting harm, especially since this is a period of intense brain development. Critical functions like decision-making, memory, learning, and attention can be damaged, potentially affecting a young person's ability to succeed academically and socially. It can also impair their mental health, and it increases the risk of using other substances. And so continued misuse can lead to addiction, especially when someone's using them to self-medicate or to cope with stress. Additionally, the dangers of overdose rise when drugs are laced with unknown or more potent substances such as fentanyl. It's also important to remember that prescription drug misuse is illegal and can result in serious legal consequences, even for youth. And so some other negative health effects. Different types of prescription drugs can have serious side effects, especially when they're misused. So opioids, for example, can cause fatigue, digestive issues, breathing difficulties. Stimulants may lead to feelings of paranoia, elevated body temperature, and a rapid heartbeat. Depressants can lead to slurred speech, shallow breathing, sleepiness, disorientation, and poor coordination. At higher doses, all of these substances carry the risk of overdose and death, particularly if they're combined with alcohol and other drugs. When prescription drugs are combined with alcohol, the risk of harmful physical effects becomes even more severe, potentially resulting in stroke, heart attack, liver failure, internal bleeding, brain damage, and many other life-threatening consequences. Opioid-related overdoses, in particular, often involve the presence of other substances, which makes them even more dangerous. Among youth, stimulants and benzodiazepines are the most commonly involved substances in case of overdose. There's also a risk of counterfeit pills, which we'll get into more, but drug traffickers and dealers may cut illicit drugs with other substances to extend their supply or charge more for less of the actual substance that they're trying to sell. So pills can be cut with flour or chalk, or more potent drugs like heroin or fentanyl. And these illicit drug supplies are not regulated in any way, so it's difficult for anyone to know what they're truly taking. And so many people hear about counterfeit pills and they ask, okay, but why would dealers lace their products with something that could kill their customers? A valid question. Illicit drugs are often cut with other substances to extend the supply or to cut costs. Fentanyl, which I'm going to talk about in more detail in a moment, is cheap and easy to produce. When laced with other popular drugs, it can mimic or enhance the high of the preferred substance, while also being highly addictive. So it's creating a consistent base of customers. Fentanyl may not kill a seasoned opioid user who has built up a tolerance to opioids, but it is likely to cause a fatal overdose in an inexperienced opioid user, which is why young people are at such high risk. And when it comes to counterfeit pills, even if the person giving them the pill is a friend or an acquaintance who doesn't want to harm them, that person might not realize that the pills that they have are contaminated or counterfeit. You can't tell by looking at them. Some kids think that they can trust their dealer, who may be a classmate or a kid they know from the neighborhood, but that dealer is getting the drugs from somebody along the dealer chain who is not trustworthy. So let's dig into more about fentanyl. So what is it? Fentanyl is a synthetic opioid that is 50 times more potent than heroin and 100 times more potent than morphine. It's been used in medical settings since the late 1960s. Because of its potency and its ease of synthesis, it's been a major target for illicit drug manufacturing and use. But it does have legitimate medical uses. Its clinical names are things like Sublimaze and Duragesic. It can come in the form of tablets, injectables, lozenges, and skin patches. It's used as a very effective treatment for severe pain or pain after surgery, and sometimes to treat chronic pain for patients who've built up a tolerance to other opioids. But illegally, fentanyl has been found as a powder, a liquid, a pill, and other forms. So why are we hearing so much about fentanyl today? It's a powerful opioid pain reliever, and it's very commonly used in surgical settings because of that potency. But illicitly manufactured fentanyl is what our concern is, not the fentanyl that people are using in the hospital. It's cheap to produce, and when it's mixed into more expensive drugs, it allows traffickers to increase their profits because they can use less of the more expensive substances while maintaining the same volume of product. So as a result, fentanyl has significantly infiltrated the illegal drug supply, including counterfeit prescription pills that are often misused by youth, as well as other drugs like cocaine. When fentanyl is mixed with other substances, it can dramatically amplify the effects and greatly increase the risk of overdose, making it one of the most dangerous elements in today's drug landscape. Because fentanyl is so potent, it only takes about 2 milligrams to lead to an overdose for most people. To emphasize how little fentanyl is needed to lead to overdose death, this is compared to 30 milligrams of heroin that it typically takes someone to overdose. Many people are unknowingly exposed to fentanyl. This is especially true of young people. Most young people do not seek out fentanyl, but are unknowingly introduced to it. Rather, they're introduced to it unknowingly when other popular substances are laced with fentanyl, and they're getting it through their friends or dealers or e-commerce websites or other social media platforms. And so I'm sure we've all heard stories like this over the past decade or so. Someone is in pain or at a party, and a friend or an acquaintance gives them a pill that they believe to be oxycodone or some other prescription painkiller. But it turns out that the pills are not legitimate. They've been made to look exactly like a prescription pill, but they contain fentanyl, and the person who takes it accidentally overdoses. And so this is a lot of what the fentanyl crisis looks like today. Since 2015, fentanyl has been increasingly found in counterfeit pills that are made to look like prescription opioids, prescription benzos, and other commonly misused medications. And so this trend has really devastating consequences. Between August 2019 and March 2020, overdose deaths among adolescents aged 14 to 18 more than doubled. The vast majority of these deaths, about 84%, are considered unintentional. Drug overdoses have sadly become the third leading cause of pediatric death in the US, following firearm injuries and motor vehicle crashes. And what's especially concerning is that these rising overdose rates are occurring even as overall adolescent drug use is declining. And so adolescent drug fatalities more than doubled in recent years, primarily due to opioids like fentanyl. You can see in this graph here, fentanyl overdoses are the dark blue at the bottom of every bar. They make up the largest proportion of adolescent overdose deaths. Total adolescent drug overdose deaths decreased slightly by the end of 2023 and have decreased slightly nationally since then. So that's some good news in the wake of some very tragic years. And so what teens are at risk for overdose? Adolescents at risk of unintentional overdose fall into a couple distinct categories, each with different vulnerabilities. First, there's those who experiment with substances but don't have an opioid use disorder and aren't really planning on trying to use opioids. So these young people may be unaware of the dangers posed by fentanyl, especially when it's hidden in counterfeit pills that resemble legitimate medications. Then there are adolescents with mental health challenges or trauma who may turn to substances like prescription pills as a way to manage their symptoms. Finally, a small number of adolescents do have an opioid use disorder and may knowingly use fentanyl, often in combination with other substances. Across all of these groups, additional risk factors such as polysubstance use, living in unstable conditions, early initiation of drug use, and a lack of access to treatment further increase the likelihood of an overdose. Tragically, many of these overdoses are unintentional, driven by the lack of awareness and the increasing potency of the drugs being used. So all of this sounds very scary, but what can we do to keep kids safe? Part of it is modeling safe prescription medication use as adults. So modeling safe behavior with your own prescription use is very important. This includes keeping medications out of sight and reach of children of all ages, properly disposing of medication when no longer needed. Lots of police departments and the DEA will do drug take-back days where you can get rid of medications that you don't need anymore because we don't want to dump them down the sink or in the toilet. We want to not use more medication than needed for longer periods of time, and we want to make sure that kids know that pills and medicines aren't the cures for everything and aren't always the best first option. For aches and pains, we can show kids that sometimes it works to use a hot bath or a cold compress first. For mental health challenges, we can try therapy. Cognitive behavioral therapy might be enough to help us through it. There doesn't always have to be a pill to solve our problems. We also want to know the signs of prescription drug misuse so that we can enable ourselves and family members to intervene quickly and effectively. So some signs include significant or unusual changes in mood or behavior, drowsiness, dizziness, confusion or slurred speech, loss of interest in academics or things that they used to like, a lack of focus, if their grades are slipping, poor attendance, having conduct problems, disregard for school or family rules, and a failure to fulfill responsibilities at home or at school. And also things like medications going missing, the drug cabinet at home, missing pills, moving through prescriptions at a higher rate of speed than normal. And teenagers may display some of these signs for other reasons, but the important thing is to notice if it's a marked change from their usual. We also want to be aware of social media as a source. Though it's illegal to buy and sell prescription pills online, social media and messaging apps have become a common avenue for young people. There's encrypted apps like Signal and WhatsApp and Telegram, as well as platforms with disappearing messages like Snapchat and Instagram vanish mode. These make it easier to hide these exchanges. Some apps will prohibit drug-related terms, but teens often bypass these rules by using emojis and constantly evolving slang to communicate about drugs. And so that makes it really important for parents and caregivers to monitor their children's social media use and understand how these platforms work. Open and honest conversations are crucial. Parents should talk with their teens about the dangers and legal consequences of buying, selling, or using substances online. These behaviors are not only illegal, but can also lead to serious health risks because of that lack of quality control in the illicit drug market. So even if someone knows another person got a pill from a seller, took it, and was fine, there's no guarantee that they will be safe. It's really important that everyone knows about naloxone or Narcan. So naloxone is an opioid receptor antagonist. So it's a medication that works by quickly reversing the effects of an overdose. So it binds to the opioid receptors in the brain and blocks the opioid's effects. You can see it in the picture here. It's a nasal spray that's very easy to use. And the great thing about it is that there's no negative effects if it's administered to someone with no opioids in their system. So maybe you see someone that is potentially experiencing an overdose and they're unresponsive, and you give them Narcan, but it turns out that they were just intoxicated with alcohol. Nothing bad is going to happen to them. So it should be administered at any sign of an overdose. And Narcan can be purchased at local pharmacies or accessed through distribution programs in communities, schools, and medical centers. All 50 states and Washington, D.C. allow naloxone to be purchased without an individual prescription, although laws and prices vary across states. So some signs of an opioid or a fentanyl overdose include things like stupor, changes in pupil size, clammy skin, cyanosis, which is your skin looking blue, difficulty breathing, and then being unresponsive or in a coma type situation. And so at any signs like this, naloxone should be administered. So what do you do in case of an overdose? The first thing is to call 911 immediately, administer naloxone if you have it, try to keep the person awake, give naloxone again after 3 minutes if the person is not responding, start CPR and rescue breaths, rotate the individual to the side in the rescue position to try to avoid choking, and remain calm and comforting if the person has been revived, and wait for EMS to arrive. Even if they wake up after being given Narcan, you still need EMS to take them to the hospital because the half-life of Narcan is shorter than the half-life of the opioids, so someone can fall back into an overdose once the Narcan wears off. So they need medical attention. So let's go through some frequently asked questions that we get from parents. The first is parents will say, if I talk to my kids about Narcan or fentanyl test strips, doesn't that condone them using drugs? And the answer is, talking to your child about fentanyl test strips, which you can use to test a powdered substance for the presence of fentanyl, or Narcan, is not going to encourage them to use drugs, nor is it going to send the message that drug use is okay. In fact, making sure your child and their friends know what test strips are and how to use them can be a life-saving conversation. It's similar to teaching your child to wear a seatbelt. It doesn't mean that you expect them to get into a car crash, but you want them to be safe if something goes wrong. Likewise, we teach young kids to stop, drop, and roll. That doesn't encourage them to start fires, but it equips them with the knowledge to protect themselves if they ever need it. And so to start the conversation, you might say something like, using drugs can be incredibly dangerous, and ideally no one you know is taking that risk. But if you do know anyone who's using drugs, it's very important that they test them to make sure there aren't any deadly substances like fentanyl mixed in. Let your friends know that test strips are affordable and easy to access through websites or community-based health departments and other organizations. Another question we get from parents is something like, my child was prescribed an opioid pain reliever after getting his tonsils removed, but since it's from a doctor, I don't have anything to worry about, right? Just because a medication is prescribed by a doctor doesn't automatically mean that it's safe or without any risk. Parents should feel empowered to ask questions whenever an opioid is being considered for their child. It's important to inform the doctor of any family history of addiction or mental health issues, as these can increase the risk for substance misuse. Parents should also be aware anytime their child is prescribed opioids and take steps to monitor that use. So this includes asking about non-opioid alternatives for pain relief, but also keeping track of how many pills were prescribed and how they're being used, and ensuring that only the minimum necessary number of pills is taken. Medications should be stored securely, out of reach of others, and any unused pills should be properly disposed of to prevent misuse. So let me go through some final resources on this topic. YSS has an inpatient addiction treatment program for teenagers struggling with substance use. For youth aged 12 to 18, Ember Recovery is individualized, evidence-based treatment in a welcoming residential environment. So you can visit YSS's website to learn more. And Before It Becomes More is your local resource for more information on this topic. Before It Becomes More is the statewide opioid prevention and awareness campaign. If you're watching this video, that likely means that you've already explored some of the resources available on the website, but if you haven't, we encourage you to go to yss.org/beforeitbecomesmore for more information and resources. Through Partnership to End Addiction, there's many free resources available on our website, drugfree.org. One of those is the Prevention Checkup, which is a free short survey that you can take to get a snapshot of your child's risk and protective factors, expert tips to lower your risk and build resilience, and quick links to resources that you can use right away. It's totally confidential, and you can skip any question that you like. We have guides for families on our website about fentanyl poisoning and counterfeit pills and medication misuse if you want to look up more information about these topics. We also have a whole harm reduction resource center. So if you want to learn more about Narcan, about test strips, about safe injection sites, all things harm reduction we have on our website. And finally, if you're concerned about a loved one's substance use, we have a helpline, we have online support groups, we have personalized text messaging programs, we have free self-paced trainings on our website, and more. So please reach out to drugfree.org if needed. From your friends at YSS and Partnership to End Addiction, thank you so much for watching this webinar.